Assalamualaikum. There is another specimen of heart. Just have a quick review of external features on this specimen. I am holding the specimen in its anatomical position. This is apex of heart. This is right ventricle. This is left ventricle. This is right atrium and this is right auricle. This is right side, right atrium, right ventricle. This is left side, left ventricle. This is the pulmonary trunk emerging from the right atrium. Right ventricle, pulmonary trunk emerging from the right ventricle. This is ascending aorta, arch of aorta. These are the three branches of arch of aorta, which are clearly visible in this view. This is how it is placed. Anterior most pulmonary trunk. Posteriorly we have arch of aorta. Pulmonary trunk divides into two branches beneath this arch of aorta. Now this is the superior vena cava entering into the right atrium, and here you have the inferior vena cava entering into the right atrium. This one is the left ventricle. This is base of heart formed by the left atrium. Left atrium, left ventricle. This is posterior interventricular artery running in the posterior interventricular groove. This one is the posterior interventricular artery. This is base of heart, so this would be the posterior aspect of heart. So this would be posterior interventricular artery. On anterior side, this is anterior interventricular artery between the two ventricles. This is diagonal branch of left coronary artery running on the left ventricle. This is right ventricle, this is right atrium. This one is the right marginal branch running along the margins of the right ventricle. This is marginal branch of right coronary artery. Now let's talk about the internal features of heart. If we open the heart like this is left ventricle. If I open the heart like this would be the left ventricle. Another identification point is left ventricle is thicker as compared to the right ventricle. These are the right ventricles. This is the left ventricle. You can appreciate left ventricle is thicker as compared to the right ventricle. This is the interventricular septum, this one between the two ventricles. Interventricular septum. Now let's talk about the left ventricle first of all. This is the bicuspid valve, this one. Bicuspid valve which is present between the left atrium and left ventricle. This smooth part is bicuspid valve. This is the ascending aorta. This one is the semilunar valves. These are the semilunar valves at the base of ascending aorta. These are the semilunar valves. Now talking about trabeculae in the heart. As you already know, we have three trabeculae inside the heart. The first one is the papillary muscle. In papillary muscle, you have one end attached with the heart and the other end is free like this. One end is fixed, the other end is free. And to this free end, chordae tendineae are attached. If we see in this specimen, this is the papillary muscle. This one is the papillary muscle, and these are the chordae tendineae. These thin cord-like structures are chordae tendineae which are emerging from this papillary muscle. This is papillary muscle. You can appreciate one end is fixed and the other end is free. At its free end, these are the chordae tendineae which are extending up to the valve. This is the tricuspid valve on the right side between right atrium and right ventricle. This is the tricuspid valve. This one is the tricuspid valve. And these are the chordae tendineae which are extending from the papillary muscle up to the cusps of the valve. This was the first type of trabeculae. The second type of trabeculae are the mere ridges. Mere ridges are flattened like this. Both their ends are depressed. These are flattened. Both ends are attached. These are the mere ridges. You can clearly see these are flattened. Both ends are flattened like this. Then the third variety is Trabeculae corni. In Trabeculae corni, the trabeculae are arched like this. Both ends are depressed, but their belly is raised. These are arched like this. In this specimen, you can see these are all the Trabeculae corni. Their bellies are raised and ends are depressed. These raised structures are Trabeculae corni. Another very important example, very good example of Trabeculae corni is this. Their bellies are raised. You can appreciate here. This is the belly which is raised, and these are the ends which are depressed or attached with the surface.